So next we come to the question of how much fluids to give. On day 1, we may start in a term baby with 50 to 60 ml per kilogram per day. Usually we tend to go on the lower side of this range if the baby has respiratory distress, as majority of these babies have a risk of syndrome of inappropriate ADH secretion. And if the baby has hypoglycemia, we tend to go on the higher side of this range or even go to the next level. A premature baby of 32 to 36 weeks, you may start with 60 to 80 ml per kilo per day. And a preterm baby at 28 to 32 weeks may be at 80 to 100 ml per kilo per day. Babies less than 28 weeks, we may start with 100 ml, but we may need to do frequent reassessment and the increments will be needed more often. From day 2 onwards, we increase 10 to 30 ml per kilo per day based on the assessed factors which we will be discussing later. In all the above groups, we go at this pace except in the extreme preterm where we may need higher increments at shorter intervals. The maximum intake is usually 160 ml per kilo per day, except in some babies where we go up to 180 ml per kilo per day. Again, the extreme premature babies at 22 to 24 weeks are exceptions. They often need more than 200 ml per kilo per day in the first few days. And don't forget the important role of temperature regulation, the management of humidity in the preterm babies. You can review my videos. There's a playlist of thermoregulation and humidity, so you're familiar with these concepts, and you can always use this to help you manage the fluid balance as well. For example, if there is hypernatremia but your humidity is relatively lower, you can increase the humidity, so the relative increase in fluid to manage the hypernatremia can be lower.